Hello everyone. Here I'll discuss about the gross features of testis. This section includes the features and structure of testis, coverings of testis, parts of epididymis, and contents of spermatic cord with some clinical aspects. Then in this figure what you're seeing, this is the lower part of this anterior abdominal wall with this inguinal region. This part is the inguinal region. Then here this muscle here, this is the external oblique muscle. Here you can see this is the anterior layer of the rectus sheath with this rectus abdominis muscle. Here it will get a bony prominence, that is the anterior superior iliac spine. Here we'll get this one is the pubic symphysis. Then here we'll get this is the pubic tubercle will be there. So this is an aponeurosis of this anterior abdominal wall muscles that forms, that is the inguinal ligament. That is the inguinal ligament. In the inguinal region, you can see there are two openings there. Okay, one is towards the exterior that forms the superficial inguinal ring. Here you can see this is the superficial inguinal ring here. So it is a triangular opening of the aponeurosis of this external oblique muscle. Okay, then this region is the mid-inguinal point. So inguinal ligament attached from this anterior superior iliac spine to this pubic tubercle. Then the midpoint, that is the mid-inguinal point. Then some 1.5 centimeter above this mid-inguinal point, there is an oval opening there that is called the deep inguinal ring. That opening is you can see in the fascia transversalis. This muscles of the anterior abdominal wall are the external oblique, internal oblique, and transverse abdominis. Deep to this transverse abdominis, there is a aponeurotic membrane is there that forms the fascia transversalis. There will get this oval opening, that is the deep inguinal ring. From the deep inguinal ring to the superficial inguinal ring, there it gets a channel that forms the inguinal canal. There you can see this is the spermatic cord. Okay, in males can see the spermatic cord with this ilioinguinal nerve. In the females, this inguinal canal transmits, that is the round ligament of the uterus with this ilioinguinal nerve. So here this is the spermatic cord. Then here you can see this is the scrotum. This is the right scrotal sac with this testis. So this is testis, you can see. So location of the testis, that is in the scrotum. It is suspended in the scrotum by means of this spermatic cord. So testis, these are male gonads, okay, and it's suspended in the scrotum by this spermatic cord. Then in this figure you can see the testis clearly. So this part is the spermatic cord. Here this is the testis. It has two poles. One is upper pole, lower pole. Upper pole relates to the head of the epididymis. So this is the head of the epididymis, which continues as the body of the epididymis. Then it forms the tapers to form the tail of the epididymis and continues as this one, that is the vas deferens or ductus deferens, which transmits this spermatozoa. It gets produced in this testis and stored in the epididymis, gets matured there, then transmits to this vas deferens or ductus deferens into the prostatic part of this male urethra. Okay. So coming to the features of this testis, this is the upper pole, leads to the head of this epididymis. This one is the lower pole. This is the anterior border. This is the anterior border. Then where it relates to the body of the epididymis, that forms the posterior border. So this is the posterior border of this testis. In the first image, here you can see this is a head. This part is the head. This is the body of the epididymis, then forms the tail. So this border, this is the posterior border of the testis. Okay. Additional to that, You can see in the upper lateral end of the testis and relates to the head of the epididymis, there is a space there. That space is called the sinus of epididymis. That is the sinus of epididymis, which lies laterally. And this location of the sinus helps to determine the side of the testis. So the sinus lies laterally. So this is the lateral surface of the testis. This is the lateral surface. In the first image, here you can see this is the sinus. So this is the lateral surface. This surface, this one is the medial surface. So this is the right testis. So this is the right testis. Okay, sinus lies laterally. Okay, this is the posterior border. This is the anterior border. This is the upper pole. This is the upper pole. This one is the lower pole. That's about the parts of the testis. Here also you can see the testis with epididymis. This is the upper pole. This is the lower pole. Here you can see the scrotum that is cut. This is the head of the epididymis, body. This is the tail, continuous. This is the ductus deferens. This one forms the posterior border. This is the anterior border. Here we'll get the sinus of the epididymis. So this is the lateral surface. This is also right testis. Then coming to the coverings of this testis. First, from exterior to interior, there is tunica vaginalis, tunica albuginea, and tunica vasculosa. Coming to this tunica vaginalis, okay, it is the remnant of the processus vaginalis that I'll explain. Here it has two layers. There is the outer layer, parietal layer of tunica vaginalis, and this is a visceral layer of the tunica vaginalis. Okay, parietal and visceral. So between there we get the cavity of the tunica vaginalis. It's peritoneum, so it's serous membrane. So it is contains the cavity contains serous fluid. Okay, then for the friction-free movement of this testis, then here deep to this visceral layer of this tunica vaginalis, there will get the tunica albuginea. This is the tunica albuginea. It is a dense fibrous layer, appears as white in color. And also while during performing sonography in this pregnant woman, this one helps to identify the gender of this fetus. So this is the tunica albuginea. It's a dense fibrous capsule, appears white in color. Then inside, innermost, we'll get the tunica vasculosa, this vascular layer which lines the lobules of the testis. Okay, so these are the coverings. Then in this figure also you can see this is the spermatic cord. Here this one is the testis. This is upper leads to the head, body, tail of this epididymis. Then this surface, this is the lateral surface. Here this you'll get the sinus of this epididymis. Then there is a remnants of this paramesonephric ducts and mesonephric ducts. A paramesonephric duct forms the appendix of this testis. Then the remnants of this mesonephric duct forms the appendix of this epididymis. These are remnants also you can see here. Okay. So here you can see this is the tunica vaginalis. See this layer. This is the tunica vaginalis parietal layer. Visceral layer is closely attached to the surface of this testis. Okay, visceral layer of the tunica vaginalis. Deep to that we'll get the tunica albuginea. Then coming to the structure of the testis. Here in this figure, So this layer, this is the tunica albuginea. When we take section, that is the sagittal section, you can see the numerous lobules will be there. Okay, that means this tunica albuginea is forming septa. Okay, it's sending septa into the substance of the testis and forming numerous lobules. See, one lobule can see, other lobule can see. So numerous lobules can see. Each lobule contains this called seminiferous tubules. See, this is the seminiferous tubules. Okay, this tubules consists of spermatogenic cells which produces the spermatozoa, and supporting cells will be there, and also there will be the this one Leydig cells also there, which produces this testosterone. See, there are some 200 to 300 lobules will be there, and each lobule contains this called seminiferous tubules of 3 to 4 in number. Then towards this posteriorly, the seminiferous tubules converge to form some straight tubules. See, here you can see the straight tubules. The coiled seminiferous tubules converge to some straight tubules that are 20 to 30 in number. Then, which is forming a network, okay, at the posterior end, that is the hilum of this testis. Their connective tissue is dense, and that is called the mediastinum testis. The network of these tubules there is called forms the rete testis. Okay. From the rete testis, there are numerous efferent ductules. See, these efferent ductules are coming. That is also some 12 to 13 number, which is entering into this one. That is the epididymis, head of the epididymis. Okay. So formation of this sperm that is in this seminiferous tubules. Okay. Then through this straight ductules, through the rete testis, efferent ductules, then it is gets stored in this epididymis. From there, it will get matured, aqueous motility. Then to this is the body. Here gets the tail. Then to vas deferens. Okay. Then it opens into this the prostatic part of the male urethra, prostatic urethra. That's about this lobules, seminiferous tubules, rete testis, efferent ductules. Then additional to that, you can see here this is the tunica vaginalis. This is the parietal layer, and this is the visceral layer of tunica vaginalis with this cavity, so the cavity of the tunica vaginalis. This is the tunica albuginea. Then here you can see this is the anterior border. Here I'll get the posterior border. Okay, that is the sagittal view. So this part is the rete testis. From here you can see this is the efferent ductules. This is the head of the epididymis, body, tail, ductus deferens. So here you can see the arteries coming, entering the testis through this hilum. So this part is also called the hilum of testis. Then coming to the spermatic cord. So testis is suspended in the scrotum by means of the spermatic cord. So its main content is the vas deferens or ductus deferens with some tissues also there, layers of tissues. Here this is the scrotum. Here contains, this is the testis. Okay, its coverings from inner to outer, this purple color, that is the tunica vaginalis. Okay, outside there, outside to that, okay, there is the internal spermatic fissure. See, this is the internal spermatic fissure. Before that, the testis develops from this posterior abdominal wall. Okay, it's from the posterior abdominal wall. Then it descends, okay, from the lumbar region to this iliac fossa, then towards this inguinal canal, then finally to the scrotum. Okay, so while descending, a part of the peritoneum is also descends along with this testis, and part of this tissues of this muscles, anterior abdominal walls muscles, along with the fascia transversalis also descends, that forms the coverings of the testis. Okay. Here, so there is the purple, that is the tunica vaginalis. Here innermost, this is the tunica albuginea. Then there will get the outer to the tunica vaginalis will get the internal spermatic fissure. Actually, this internal spermatic fissure that is derived from the fascia transversalis. Okay. Then outer to that will get the cremaster muscle and fissure. This cremaster muscle and fissure, this is derived from the internal oblique and that one transverse abdominis muscle. Then outermost here you can see that is the gray color one. See this gray color one, that is the external spermatic fissure that is derived from this external oblique muscle. Okay, so these forms the coverings of this spermatic cord. Then in the scrotum, here they'll get this the spermatic cord. So here the scrotum, additional to that there will be the skin will be there, scrotal skin. Then it contains some subcutaneous muscle, that is the dartos muscle, a fat free subcutaneous muscle, that is the dartos muscle is there. Okay, dartos muscle. So here you can see the cross section of the spermatic cords. This is the spermatic cord, can see. So its coverings are the here you can see this is the internal spermatic fissure. See, this is the blue color one, that is the inner total internal spermatic fissure that is derived from the fascia transversalis. This brown color, that is the cremaster muscle and the fissure that is derived from this internal oblique and transverse abdominis muscle. Then there is here, this is the external spermatic fissure, that is a gray color, that is derived from the external oblique muscle. Okay, these are the muscles of this anterior abdominal wall. Okay, then here next is the contents of the spermatic cord, which are the structures you can see in the spermatic cord. An important structure we already know. Here this is the ductus deferens. Okay, ductus deferens. Then here you can see this is the artery to ductus deferens. Then veins of this testis, that is called the pampniform plexus of veins. Then artery of the testis, that is the testicular artery. Then lymphatics, nerves. These are the, then also there is the genital branch of this genitofemoral nerve also there. Okay, these forms the contents of the spermatic cord with these coverings. That is the internal spermatic fissure, cremaster muscle and fissure, and the external spermatic fissure. It contains main content, that is the ductus deferens with the arteries, ductus deferens, then this cremaster artery, testicular artery, pampniform plexus of veins, lymphatics, nerves. Okay. Then that's about the spermatic cord. Then blood supply of the testis. See, this is the anterior border, this is the posterior border. Okay, here this forms the hilum of the testis. You can see this is the testicular arteries coming. Testicular artery is a branch from this abdominal aorta. Okay, then venous drainage. Okay, as pampniform plexus of veins. Okay, so there are the veins, some 16 to 20 veins are there. Okay, it's coming out from the testis. So that plexus, that veins plexus, that is called the pampniform plexus. Okay, then which then condenses into 4 veins. That numerous 16 to 20, it condenses into some 4 veins at the level of the superficial inguinal ring. Then it condenses to 2 veins at the level of this deep inguinal ring. Then forms the testicular vein, right and left testicular vein. The right one opens into this inferior vena cava and the left one is opened into the left renal vein. Okay. So this left testicular vein is larger than the right. So there is any enlargement, dilatation or tortuosity of the spamniform plexus forms the varicocele that is common in the left side because left is longer. Okay, so varicocele, coming to this varicocele, here you can see this is the dilated, tortuous, engorged pamniform plexus of veins, okay, which forms this varicocele. Okay, actually the varicocele can affects the which lowers the sperm count and the growth of the sperm, can cause fertility issues. Yes. Then here you can see this the lymphatic drainage. See, this is the testis. It shows the para-aortic lymph nodes on each side of this abdominal aorta. The scrotum, this lymphatic drainage, that is shows the superficial inguinal lymph nodes. Then nerve supply, that is the autonomic, that is to the T10 segment of the spinal cord. Then here you can see this the descent of the testis. I already told testis starts developing from this posterior abdominal wall, the lumbar region, okay, towards, then it has to reach the normal position that is in the scrotum. Okay, so it begins to descend at the second month of this intrauterine life, then reaches this iliac fossa at the third month, then it crosses the inguinal canal, okay, at seventh month, then reaches the superficial inguinal ring at eighth month, and reaches the scrotum at the ninth month. Okay, so it starts developing, descending from this posterior abdominal wall, okay, at the level of the loin. Then it starts to descend, okay, from the second month of intrauterine life, then reaches the iliac fossa at the third month, then reaches this deep inguinal ring at fourth month, okay, then travels the inguinal canal at seventh month, then reaches the superficial inguinal ring at the eighth month, then reaches the scrotum at the ninth month. Okay, that's about this descent of the testis. Okay, if the testis fails to descend, that condition is called the cryptorchidism. Here you can see the cryptorchidism. Okay, testis fails to descend into the normal position. It should be either in this abdominal, okay, or in the inguinal region, or in the suprascrotal, above the scrotum. That condition is called the cryptorchidism. It is different from this ectopic testis. So ectopic testis has taken a different pathway to descent. Okay, that is the normal pathway we know. In the previous figure, I explained the normal descent of the testis. So ectopic testis, that means the testis has taken a different pathway for the testis, and it reaches an unusual position that should be either in this prepenile, that is in the back of the penis, or the superficial ectopic, that is in the external oblique muscle, over this aponeurosis of the external oblique muscle, then transverse scrotal, that is in this inguinal canal or in the opposite scrotum, then femoral, it should be there in the femoral canal, peritoneal, it is subcutaneous. That is the ectopic testis. Okay, subtypes of this ectopic testis. Then that's all about the features of testis, epididymis, and spermatic cord. Now you can able to answer this. That's the gross features of testis, which includes those parts, coverings, then structure in the sagittal view, then descent of testis, okay, where and all it reaches during the descent of in the intrauterine life, then contents of the spermatic cord. What is the spermatic cord? Okay, which are the structures you can see in the spermatic cord. Then let's try to find answer for this. Okay, there is a premature male infant was brought to the hospital. Mother complained of scrotum empty on right side with right inguinal swelling. Okay, why is the right side of scrotal sac empty? Why? It's a premature child. Okay, so testis is undescended testis. Testis has not descended. Okay, testis has not reached at the scrotum. What is the mass in the inguinal region? What is the mass? That is the testis, right testis. Okay, what are the time events of the descent of the testis? Okay, should from the 2nd month to the 9th month that it reaches at which and all levels we should know. Okay. Yes. Thank you.